Hello, I'm Hannah Kaplan, and this is the WCS Wild Audio Podcast, where you'll find reported audio stories covering the latest news and newsmakers from the Wildlife Conservation Society's Global Conservation Program, Zoos and Aquarium, and their many partners. We've got a great show today, so let's get to it.
WCS's global health team has been closely watching the spread of avian influenza, first as it decimated populations of bird species around the world, and recently when it jumped to mammals. In this two-part series, Hannah Kaplan looks at the potentially devastating impacts of this growing wildlife pandemic and what's being done to slow its spread.
We're talking about hundreds of thousands of birds to millions of birds dying, which has a massive impact on avian biodiversity around the globe. This is a global situation.
Influenza isn't new. This class of virus has probably been around for thousands of years, responsible for global pandemics like the 1918 influenza and swine flu.
As you're aware of, seasonal flu, for example, also consists of influenza viruses. And one of the big groups of influenza viruses are the so-called influenza A viruses. It's really good at exchanging genetic information in a process called reassortment.
But, says Chris Walzer, Executive Director of Health for WCS Global Programs, what has changed is the anthropogenic factors making it easier for these viruses to spread. This strain of avian influenza currently circulating was first identified in China about 20 years ago, where outdoor industrialized poultry farming put ducks and geese, homogeneous birds impacted by an aggressive strain, in close contact with wild bird populations. Wild birds had been affected before, but this had been by seasonal variants with low mortality rates.
And there's plenty of opportunities for wild birds and production birds to exchange virus components, and so this is it's always been a hotbed of emergence.
But in 2020, this changed when a new, more virulent strain emerged, which was only a matter of time as viruses are constantly evolving.
And suddenly, wild birds became a reservoir and basically were able to maintain high-path avian influenza.
This new high-path, or highly pathogenic strain, affects wild birds year-round, which means it now follows seasonal migration routes. Soon, birds across Europe and North America were testing positive. More recently, it's been confirmed in South America and Antarctica. Australasia is currently the only place it hasn't yet been detected.
This avian influenza outbreaks became what's called endemic. Basically, they're around all year round, and there's a constant shedding of viruses into the environment amongst animals. So for the first time that we know in this impact, we've seen the virus move along the flyways with the wild birds into a naive environment of Latin America and targeting birds which had previously had either very, very little or more likely never had any contact to avian influenza.
Avian influenza is colonizing populations already stressed by climate change and displacement, access to food, pollutants, and other human threats. Arctic bird populations like penguins are especially vulnerable, already pushed to the limit by climate change.
That's why disease and impact of pathogens on wildlife is a different game than it was 50 years ago, where we had large populations, they were connected, they were resilient, you always had die-offs. But now we're talking about smaller populations that are fragmented, that are also impacted by multiple other anthropogenic drivers.
In this perfect storm of high infection rates among birds, scientists were soon receiving reports of large-scale die-offs of mammals like sea lions and elephant seals.
We had this impact on sea lions and mammals. So hundreds and hundreds of sea lions dying along the coastline, along the beaches. We saw the impacts on elephant seals, with the mass die-off of the pups. This is always a really important difference. It's the naive pups which were basically wiped out by this virus within a few days. There are hundreds of wild birds. I think it's about 200 wild bird species that have now been, where it's proven that they will succumb to avian influenza. But the list of mammals is also extraordinarily long. It's about 50 mammal species now, more or less, that have been impacted.
In 2022, WCS Peru wildlife health specialist Paulo Colchao and a team of scientists were notified about a large number of deaths in a pelican breeding colony off the coast of northern Peru.
It was shocking because of the amount of dead pelicans. No, they were everywhere. We are talking about hundreds. Because they were in breeding season when it started, a lot of eggs were left behind. And we only see like bones and feathers everywhere, no?
The cause of the die-off, avian influenza, soon spread like wildfire.
After that, it starts to advance through the country, through the coast of Peru, going south, affecting different seabirds colonies across the whole coast of Peru, no? And in the end, it affects more than 20% of the population, at least, that have been recorded.
Word soon came of the deaths of a staggering 8,000 South American sea lions in just one colony alone. The close proximity of breeding or pregnant animals provided a perfect opportunity for the influenza to spread, wiping out multiple generations in a matter of weeks.
Most of them were pregnant females. I worked before with this kind of animals and it was really rare to see these animals dead meanwhile they were pregnant. Yeah, that was devastating.
The obvious question is, if avian influenza has now made its jump to mammals, are humans next? Chris notes that while the spillover of the strain of influenza to humans is still low, roughly half of those who get infected have died. The concern, he says, is that mammals are now effectively a training ground for permutations of the virus, some of which might be more dangerous to humans.
So the virus is learning to adapt to human cells and to mammal respiratory tract cells and so on and so forth.
WCS's role is at every level, supporting governments and agencies to assess data on the ground in real time. Teams also provide public health education, how to avoid contact with dead birds, and the right way to dispose of carcasses. While it's difficult to curb the spread of pathogens in wildlife, Paulo says that quick response is critical.
Having early alerts of these cases, to go there, to try to bury the animals, to avoid any contact with other wildlife, to avoid the shedding of the virus.
Paulo sees avian influenza as a catalyst for a greater awareness of wildlife health in Peru. He says WCS's role is informing the links between government, academic labs, specialists, and field rangers, essential as the spread continues in real time. At the global level, the team is targeting policy.
There's a very tight link between the poultry industry and wild birds, so working on making sure that the needs of wild populations and biodiversity at large are recognized when there are discussions about biosecurity and potentially vaccinations campaigns within the poultry industry. And then on the global level of the pandemic agreement, which is ongoing at the moment, the biggest risk for the next pandemic is potentially something that's going to come from the environment through wild birds at some stage or other. We need to get on it.
Despite so much worrying news, Chris notes that there are small glimmers of resistance. While it's deeply upsetting to see high die-offs of elephant seal pups, for example, he notes that adults of the species are surviving and are going on to reproduce again, which gives hope at a population level.
Always the same. It's an evolutionary battle between the host species and the pathogen on the other side. And it's a race, right? The pathogen is evolving, as is the host species. But indications, at least from Southeast Asia, are showing us that populations of birds that we've been monitoring for many, many years and that have been hit repeatedly are doing better in the face of a new wave. What we do want is while they get hit and a certain percentage will die, those that survive do develop an immune response.
And he says governments are paying serious attention. Mandatory vaccinations, not just culls of poultry, are becoming more common in Europe, which might go a long way in slowing the spread to wildlife. Chris says that the One Health model is critical to this. The idea that wildlife, environmental, and human health are interconnected and need to be approached more holistically.
This is really important when we talk about prevention and the role of conservation organizations. We're on the front lines of where these spillovers happen. Because the early recognition of something's emerging here, we need to get on it, is much better, because once it's spilled over into humans and spreading between humans, it's too late. So it is also our responsibility as an organization to keep an eye on these things and develop systems to be as an early warning system. And that's why we are integrated in these broader global health endeavors, is because we do actually see what's happening on these front lines.
For WCS Wild Audio, I'm Hannah Kaplan.
Today's episode was produced and reported by Hannah Kaplan with help from Dan Rosen and Nat Moss. The WCS Wild Audio Podcast is a production of the Wildlife Conservation Society. Please join us next week for a new episode, and don't forget to follow, rate, and review the show wherever you get your podcasts.